Hey everybody, how you doing? Steve Martirano here. A moment before we get into the nitty gritty here. Now, I got to remind you again. You will have our eternal gratitude if you just click that subscription button. We need your support in that fashion. Hit the button, subscribe. We'll love you long time here on the Behavioral Corner. Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hello, everybody. Welcome again to the Behavioral Corner. It's me, Steve Martirano, your host and guide. I hope you know what we're about here. We like to say that we're a podcast about everything because everything affects our behavioral health. It's all made possible by our great partners, Retreat Behavioral Health, and we're going to call upon them for not only their financial support today, but for their tremendous reservoir of experienced people to explain a couple of things for us. Anyway, that's what the Behavioral Corner has been doing. We talked to a lot of different people about a lot of different things, and we hope it helps you learn a bit more about your mental and physical and spiritual well-being. I can't believe, incidentally, that we're recording this at the end of August, although I must say this summer can't get out of here fast enough for me. Anyway, we're going to take a look at, for very often when we talk about substance abuse issues, which we talk about a lot on Retreat, because Retreat began as a pure substance abuse treatment facility. They have since expanded their services now to include a suite of treatments and techniques in the mental health area, which is what we're here today to talk about. It's interesting to think about what we're thinking about, what we think is going to happen when we have mental health issues, and what recovery would look like in that regard. So as I said, we're going to take a look at the Synergy portion of Retreat Behavioral Health. Their Synergy Health program, we'll find out the particulars about that with their clinical supervisor, who was our guest on the corner today, Stacey Magee. Stacey, thanks so much. I know you're busy. I appreciate your time.
Thank you, sir.
So Synergy, as I said, grew out of the work being done in the substance abuse field. For those who do not know, you do not treat substance, if you're good at this, and Retreat is, you do not just treat substance abuse issues, because there are always what are referred to as co-occurring or underlying situations that contribute to the abuse, to the substance abuse, and they are often in the mental health area. But again, you would get that treatment in conjunction with a substance abuse problem. Now, through Synergy, it's not necessary to treat your mental health issues if you have no substance abuse problems. Is that pretty much the difference between what goes on between the two sides of the company?
Yeah, well, we developed the Synergy side. We had a great need for our community, and we had a great need just in general. So, yeah, instead of it just being co-occurring disorders with substance abuse, whether it was induced or whatever, we saw the need to, we had a lot of patients just wanted to come in for just mental health only, no substance abuse. So that, I guess that was the birth of that. And so, yeah, we've got our Synergy program going, and it's going very strongly.
Yeah. How long have you been associated with, a little bit about your professional background and how long you've been involved with Synergy?
Okay. Well, I've been doing this for about 34 years, and I started in substance abuse in California. Of course, I got certified in addiction a long time ago. I was coming out of my own recovery and had a period of sobriety, and just kind of fell into the field, and they said I was good at it. So so I said, okay, I'll get certified, and so that's kind of how it began. And I was fortunate in California to be trained under a lot of very good therapists, under psychotherapy, gestalt therapy, transaction analysis therapy, cognitive therapy, on and on and on. And so that's kind of where I got my start. and I've been in this field ever since. And so at that time when I was in California, I was also a professional musician. So, and I went through my own treatment, so that's kind of how I fell into this whole thing. And so I've been doing it ever since, and I enjoy it. It's like a calling to me. It's just, I love doing it. I love helping people. And but now, of course, I moved back to Louisiana, kept doing that. Working inpatient, outpatient, like everything else.
You mean that's not a California accent?
No, that's not a California accent. I'm trying to get rid of it. So
no, it's charming. What are you kidding?
But 10 years ago, I came here to retreat, and I came out here. My family, we moved out here, and came to work for retreat. And I've been here for a little over 10 years.
Mm-hmm. It's so fascinating. Just take a little side trip here now. 35 years you have made a career out of helping others and learning how that's done and training yourself for it. And it all flowed out of a bad situation. Which,
yes, it did.
Which is, it's remarkable how life takes you in certain places you never expect to wind up, right?
Yeah, that seems how it always ends up. So, but it, it was actually a blessing, and a great turn in my life. And again, I do what I do. I love to do it,
Let's talk about what retreat does and what Synergy does, mm-hmm. and what they do not do. Let's begin with what I'm often asked about situations like this. When one talks about going to get help for mental health issues, do you go to a psych hospital? First of all, what is a psychiatric hospital, and how does it differ from retreat? Synergy.
Well, a psychiatric hospital is definitely a higher level of care. We call, retreat, we're a behavioral health. So we deal with comprehensive mental health and behavioral health services. And so, if a person needed higher care, we have our staff psychiatrists that will sometimes, refer them to a higher level of care if they come in. But we're mostly dealing with the behaviors, but we also deal with depression, anxiety, bipolar disorder, suicidality, PTSD, co-occurring disorders, So, so that's kind of what we do. We rehabilitate our patients, and whether it's through psychotherapy or counseling. And so, that's what we do here.
Yeah, I want to get into some of the techniques that are employed, but this distinction about a psych hospital and a behavioral health facility and the mm-hmm. things you treat now, correct me if I'm wrong, one of the other more obvious, or not so obvious, one of the more significant differences between a psych hospital situation and what you guys provide is that everyone who comes to retreat and Synergy for treatment is there voluntarily.
Yes, most definitely. Yeah, because some people to a psych hospital, they go through the ER, the emergency hospital, and then they're referred to, that higher level of care, and it's mandated. So.
As I understand it, most hospitals, but not all, most regular hospitals have a psych ward, or depending upon how big they are, it's a large one or a small one. If someone is having an episode, whatever it is, maybe it hasn't been diagnosed yet, or maybe it has been. Maybe it's a manic episode associated with bipolar, and they drive themselves to their friendly neighborhood hospital. Mm-hmm. They do so not under duress, but in a confused and manic state. Maybe a loved one takes them there, and now they're in the ER. If you go to the ER and you're bleeding or your arm is broken, the process pretty much takes care of itself. But what happens in a situation where a mental health disturbance is what's brought you into a hospital? I'll get to you guys in a minute. Into a hospital situation. Do you get admitted into their psych ward, or do you have to sign yourself in? What's that process like?
Well, if you're, say, for instance, if you are just dealing with depression or something like that, or anxiety, and you're having panic attacks, and you go into your ER, they'll treat you for those types of things. So their case management might refer, to maybe they see that the doctors have made a referral to, a rehab center, if it's addiction or mental health, but if you get into suicidality and stuff like that, where needs a higher level of care, then, if they do have a unit on their hospital, they'll either do that or they'll refer to a place like us,
Mm-hmm. Mm-hmm.
and of course we work with a lot of our community hospitals and different hospitals, and they know about us, so they will refer to us. But it's hopefully the hospital, they diagnose that right, and that's where they make the referral.
Yeah, that diagnosis, that first point of contact is critical.
Yes.
You've got to be in front of somebody that understands what they're doing and can recognize the level of severity here. And then, of course, there is the unfortunate situation where people can be involuntarily admitted into a psych facility. That is not what Synergy is about. There are no bars on windows. They can't keep you against your will. You've got to be there, actively able to take advantage of their mental health program. So tell us a little bit of, well, first of all, we touched upon it briefly, but tell us the sort of mental health situations you guys would treat at Synergy.
Yeah, so again, we would treat, like different disorders such as depression, anxiety, both bipolar disorder, suicidality, PTSD, co-occurring, disorders, stuff like that. So, we have onboard psychiatrists, psychologists. So when they come into retreat, they go through intense assessments and stuff, and but they're coming for us for that behavioral health, whether they're having stressors in life, whether they're having family problems, but it's mostly centered around the mental health issues that they're having that usually get referred to us. So we are a behavioral health, mental health services. So we do provide those treatments to surrounding all those diagnoses,
Stacey, during that initial evaluation or whatever, or diagnosis, whatever, the intake portion of Synergy, at what point do you require somebody to be drug tested? Because they may show up saying that they have a purely mental health issue and try to hide the fact that they're on substance abuse. Do you require a drug test right away?
Well, yeah, that's going to be kind of a standard thing of our policy to drug test everybody, because the medical doctor is going to meet with them for sure. And they go through a process of our inboarding. Then meet with a clinical director, a clinical person who will, a master's level clinical person will do an intake and assessment, and then they go to nursing, then they go to the doctor, and then so they go right along the line. So to evaluate, all of that, to see, what services they need.
Does Synergy provide both residential and outpatient mental health treatment?
Yeah, we do have an outpatient facility. We have one here in Akron. We have one, and we have some at Philly State College, and we do apply outpatient services. We have a patient care coordinator team that do most of the referrals to different outpatients. So, for instance, if a patient has, they live in Connecticut, so we do have services there, but we might refer to different services because some come with their own psychiatrist and their own therapist. They've been in treatment more than once, and but we have our clinical team, our PCC team is that's their job, is to refer people to the right individual care that they need.
Do you see clients, patients who come to you who may have their own psychiatrist and have been seeing it but feel like they need another level? Does that happen often?
What do you mean by another level? They do come in, with psychiatrists, but we have our own psychiatrists, within 24 hours, they see our psychiatrist and they're reevaluated.
Okay. I guess they take a full medical workup too. They want to know what kind of physical shape you're in as well, right?
We're going to do histories, physicals, psych. We're doing it all. So it's very thorough.
Our guest is Stacey Magee. Stacey is a clinical supervisor for Synergy Health Programs, a division of Retreat Behavioral Health. We mentioned a lot of things that you guys treat. They are not all the same problems. They each are unique in their own way, whether it's post-traumatic stress or anxiety or something like bipolar. Tell us some of the and so the treatments would vary. What are some of the treatments that you guys employ to handle those things?
Well, we employ a lot of different types of treatments. Of course, we do acceptance commitment therapy. We do dialectical behavioral training. A patient comes in with PTSD. We could, there's been a lot of research that ACT therapy works with that, but we also can do. Many of our clinicians can do multimodal types of therapy as far as exposure therapy. I do some stuff around EFT, emotional freedom technique, stuff like that. So
I'm sorry. What was that last one?
It's called Emotional Freedom Techniques, a tapping series, and it works incredibly good. It's a tapping series on 10 areas where you tap, so it'll reduce anxiety. You do it on a scale 1 to 10. If they come in with the anxiety as a number 8, you do this tapping series. It works on the energy in the body, and it will bring your anxiety down.
How does that? I'm trying to. You're saying tapping?
Yes, you tap on 10 areas. Like there's one on top of your head.
On your body.
On your body. It's not like an acupuncture or anything. It's a tapping. And an old therapist showed me that technique, and I said, "It don't work." But did it work? And
just show me what you're talking about.
You start tapping, and you say this positive. Even though I have anxiety, I accept my anxiety. And then you go to the eye, and then you go through, and you go through the whole process. Then you see where their anxiety, if it's come down. But you can use it on smoking. You can use it on depression. You can use it on thoughts. You can use it on different types. So we do approach a lot of holistic. We got equine therapy. We got, music therapy and drumming. And, so we got a lot of different. So we really not only just those old cognitive therapy stuff, we apply a holistic program to the whole thing.
Yeah. Some of the things people who are just confronting mental health issues and even substance abuse issues have to understand or learn to accept is that there's not one magic bullet out there. There are lots of things that have to be employed until you find what's working, and you never know what's working until you see it working. The tapping is fascinating. I'd not heard that before, although I do remember relaxation techniques back from my hippie days, where we were looking for different paths, and one had to do with we tend to, you'll probably appreciate this. I was told we tend to center our notions of where our consciousness is in the area above our head. That's where consciousness resides. And the instructor was saying that's the standard thought, but the next time you whack yourself in the thumb with a hammer accidentally, you'll find out that your consciousness has just shifted to your thumb.
Yeah.
Okay. And he said all that means is that you can move your consciousness around your body.
Wow. Yeah.
So he said, and one of the things he showed us was that there is normal tension in your jaw that you're not even aware of.
No.
That you can, if you just try relaxing your jaw muscle, an enormous amount of tension can be drained away. So I guess that's how that tapping thing works, right?
Well, it's based on theory. If you have anxiety, your body is trying to exert all this energy, so and then it's causing more pain or it's causing more anxiety. So I describe it like it brings your body down to homeostasis almost. So
if you can get that rhythm going, it slows everything down to the beat.
Yeah. So we teach our patients how to do that, and they can just learn it and do it. Like teach progressive muscle relaxation. We do self-soothing exercises. We do just a number of things. And that's what I like about our therapy team and Synergy. They bring such a wide variety also with their therapy, but we're using empirical things that just work,
And all of these have been what's referred to as evidence-based. There are studies that show this stuff has worked.
Yes.
Well, all of the things you just discussed in general can be described in some way as talk therapy. There's that transaction, that interaction. What about treating some of these mental health issues with drugs? Does that go on at retreat?
Most definitely. That's why they meet with the psychiatrist within 24 hours. That's mandatory on our synergy side. And, that we do medication management. They're going to get, of course, we're grabbing the histories, that we needed even the histories from their former psychiatrist, according if they get consent to do that. So we do medication management here.
And it's important to know what they're on now if they get to you or be prescribed. Let's talk about bipolar disorder, because I think there's a growing awareness of that disorder. It seems to be growing in prevalence. As I understand it, and I guess this is true in any mood disorder, you can't go to the shelf and say, oh, this works for that. Let's prescribe it. It's almost more an art than a science, coming up with the right drugs that can help somebody. Is that true, basically?
Well, you got to think about this. Our bodies are chemical. So we got all these hormones and all this stuff. So some of the medication that's provided, what works for you might not work for me. That's why we have a class of SSRIs or different types of medication, to treat different, disorders. But, our body's just like allergy medicine. What allergy medicine I take doesn't work for you. It don't work for me. So it's finding those combinations, and that's the psychiatrist's job and the medical team's job to find what works for that person. And the important thing is getting the right diagnosis. That's incredibly important. And then followed by all that is where the clinical team comes in. And then, because medication management is just not the only thing. It works to like 30 to 40%. So we need to do the coping skills, therapy techniques, whether you got family problems, trauma, or whatever you got going on. That might be related to bipolar disorder, why they're manic, why they haven't, that's in that class of mood disorders.
Again, no silver bullet. There's not a drug that's going to cure it all by itself. It's in conjunction with other modalities as well. I mentioned the, drug treatment here because there's another aspect of it that I wanted to ask you about. And, the diagnosis is absolutely critical. Getting the right drug for the right person is obviously important. It then becomes incumbent upon the person who's got the mood disorder to stay on their medicine.
Yeah, that's a challenge for some patients, because it's like everyone else. You don't want to stay on your medication. You don't want to, be, taking medication all your life. But mental health is a lifetime process. And that's what we have to understand about behavioral health or mental health. And medication management is critical. Because
go ahead.
Yeah, because I was saying, if you have depression, you have it's a medical condition. If you have low serotonin levels, well, that can cause depression. So, we have these SSRI uptakes, this medication that will help, the level of that serotonin, so the person doesn't feel depressed.
The comparison I've always heard is that, look, if you're a diabetic, you need insulin.
Yeah,
that's what your life now is made up. Administering insulin. Same thing with mood drugs, mood disorders. There's a little bit of a difference because you're cognitively aware of your diabetes and your need for insulin. When you're having a psychiatric problem or a mental health issue, your mind is what the problem is. It could be telling you, well, I don't need this anymore. I feel great right now. That's what you meant by a challenge, right?
Yeah. It's and then we're also dealing with the behavioral issues that involve, not wanting to take medication and stuff like that. Or yeah, we have some patients that, just they might be psychotic. They might be, having delusions or something like that. So that's where the medication management comes in, and the clinical aspect also.
Side effects are often a big factor in whether people take their medicine or not. Have they gotten better over the years of managing the side effects of some of these mood drugs?
Well, every drug's going to have side effects, but I think, that's kind of a hard question for me to answer. I'm not a doctor, so but I think. I meant from the behavioral side. When I stopped taking them because I was gaining weight. That's a behavioral thing, okay. Yeah. So So that's why we have psychiatry, though, to follow up, and a clinical team, to deal with those types of behaviors and to educate. We have to educate these patients, so that's why the psychiatrist is educating on the medications, the side effects, just like a regular doctor would. And, again, where our clinical team steps in, our therapists step in to deal with their behaviors.
Stacey, I want to move to sort of the final portion of what we're talking about here, but just one more thing about bipolar disorder or any manic, or even a depressive situation or anxiety. Mm-hmm. With regard to bipolar disorders, are there triggers that people suffering from bipolar can learn to identify and avoid? Like there are triggers for substance abuse people. Are there, in other words, are there things that might trigger a manic episode and people can learn what they are and avoid them?
Yes, that most definitely. And that's what our clinical team and our therapists do, helping our patients identify what those triggers are, whether it's a family issue, whether it's, just trauma, it can be trauma, because trauma has a lot of triggers, but helping them recognize, when they're going into that manic state, or, what to do about it, and giving them the tools, the coping skills, how to self-soothe or breathing exercise, whatever we do to manage that disorder along with medication.
Yeah, because in the situations of a bipolar disorder, once you're deep into the episode, whether it's depressive or manic, it's you're sort of beyond rational thinking at that point. So you've got to be alert to it before it happens, I guess.
Yeah, that's where our therapists, you have a relapse prevention plan for addiction, but there's a relapse prevention plan for mental health.
Oh, that's interesting.
So,
and that's
yes.
Yeah, that's what I wanted to segue into at the end of this, because looking at the two situations, this purely substance abuse disorder, not purely, but a substance abuse disorder and a mental health issue, we easily understand the notion of recovery from substance abuse. I mean, you can see it. If someone's not using and their life's back together, they can be said to be in recovery. When we talk about mental illness and recovery, I mean, what are we talking about? Do people recover from mental illness?
Well, with mental illness, of course, it's a behavioral issue, moods issues. But again, I think I said this is a lifetime disorder. If you have a bipolar disorder or depression, it's treated by medication, it's treated by, clinical, and so, that's going to be with them for life. And it's learning how to deal with it, learning the right skills, taking your medication, follow up with your psychiatrist, follow up with your aftercare, your therapist, and it is sort of like a maintenance program. Mm-hmm. But, this is a medical issue, though. Depression is a medical issue. Bipolar is a medical issue. Can PTSD be induced by trauma? Yes, it can be produced by trauma, which causes effects in the brain, which causes a mental health disorder.
And mental health disorders still labor, I think, to a greater degree, or struggle to a greater degree, under the lingering stigma of mental illness
Oh,
than substance abuse. I think over the years, the public has gotten better at understanding substance abuse as a sickness, as a disease. But there is still, I think, well, you tell me, I think there's still a stronger stigma attached to mental illness that needs to be addressed.
Yes, and that's where prevention comes in. How can we educate our community more? And that's what Retreat is about, to try to deal with some of that stigma. That's why some of us will go talk, to our local libraries, to people in our communities, educating them on mental health, what it looks like, how can you treat it, what do they need to do? Prevention is just, we need that greater, in our communities, in our society, period. And because a lot of people do not understand mental health. They just think, how'd the person get homeless? Well, usually it may start with a mental health disorder. It could, so it could be a military person would come back from war and have trauma that ends up homeless, because of what is happening in their brain. What is, so.
Yeah. We're making great strides of learning about the brain, which is still, no matter how sophisticated scientific we are, is a mystery.
Yes.
We learn a lot about neurology all the time that can only help. Well, I wanted to get you on the corner because we need to talk a lot more about what goes on at a place like Synergy, the programs that are available. Because as bad as the substance abuse issue is and overdoses, and we know that story, there is another story going on. And I think you would agree that there is a mental health crisis in this country. We have a lot of people who need a lot of help, and they might not be getting it. So, Stacey Magee, thank you so much. And I hope I can call upon you again as a guest on the corner. Appreciate your time.
Appreciate your time. And thank you so much for having me.
Thank you all too as well. Behavioral Corner, you can subscribe. There's a button right there at the top. Bingo. That makes my day when we get another subscriber. And follow us on Facebook and Instagram. And you'll find us wherever finer podcasts are found. Take care of yourself. See you next time on The Behavior.
Retreat Behavioral Health has proudly been serving the community for over 10 years. Here at Retreat, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 or visit us at www.retreatbehavioralhealth.com to begin your journey today.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.